a large room or combining couples of rooms or assimilation of some cups under single management or in general. Please don't start making noise. I don't want this. Please, don't start disturbing us. This is the rule of the day. If you continue to disturb, I will leave the class. Since I have not been made a host, that is why I've been having a problem removing you from the class and pinning you. If I have been a co-host, then I could have managed the class. So I've asked the host to also let me be the co-host, because if you disturb, I have to remove you from the class, but they have not given me that kind of access. So if you disturb, I would rather leave. Okay. So what are the functions of inpatient services? So hospital inpatient services basically covers what? It's 1/3 of the total hospital complex. So the functions of inpatient service, they are to render nursing care to all patients, to provide necessary equipment, essential drugs, and all other stores requirement for what? Patient care in an organized manner in the wards. It also provides opportunity for training medical nursing and paramedical nursing and medical staff, besides what? Conducting research. So these are the when you're on the ward, the major function is what? To render services, quality services to all patients. But also what? Whilst we are rendering quality services, we also do some training. So when nursing students, medical students, whatever students come to the ward, we also do some retraining, and even the research will also do some research. So these are some of the functions that we render for in the ward. But basically, we render quality nursing care to all kind of patients. And when we are also, the function is also provide equipment, essential drugs, and all other stores required for patients, and as a research and as a training base. And the wards constitute what? Patient space, nursing space, and the corridors. And these are the types of wards. We have general wards and specialty wards. So when we are building a ward, these are some of the factors to be kept in mind while designing a ward. As I said, so movement of spaces, number of beds in a room, bed spacing. So you need to consider all this factor in before you design what. When you are designing a hospital or hospital ward, you factor all this. So bed spacing, position of nursing station, category of the ward, ancillary rooms, and ratio, toilets, and all those things. I told them I don't want that. You don't respect. Please stop and listen. And if you're not ready, you can leave. It's a simple thing. So the physical facilities that you can find there, we have the area, the location, the size, the shape, accommodation, water and electricity supplies, and communication. Okay, so as I was saying, the physical structure of the ward. So the ward is a physical structured area designed and equipped for patient care, as well as providing a safe environment for staff. So it's not only about the patient. What about us, the staff who also work at the hospital? You also have to provide accommodation for us. Or we also need safe environment to also work. So an ideal ward should have this. These are the lying in, and you all know that. You also have nursing station. Yes, it's very important, nursing station. We also have the lounge, treatment room. Storeroom. Storerooms, nurses' common and changing room, bathroom, toilets for patients and staff. So with this, so as I said, physical structure, the ideal word is to have all these features, all these structures. Lying in what area, you know that nursing station is very important, lunch, treatment room, store rooms, ward manager and the director in charge offices, nurses common and changing room, bathroom, toilet for patient as well as the staff. It's not only about sometimes, some ward when they've sometimes forget nurses room and nurses changing room and even toilets. I quite remember when I was back then, was working at the hospital, and there was no nursing changing room, no cupboard for them, nothing. So when you go to the wards, there's no place to put your bag, even where to change and all those things. So we were struggling. And I said, so how do we work in this environment without all these physical structures? So if you have a good in charge, she will request for that. So we did that, and they provided us one room, and they started with what cupboards, where you have your own keys, and so when you come, you open your cupboard, where you can even put your bag in there, everything that you have, you put in the cupboard, and then it's a good environment for them. So they created what nice environment for them where they can try. Okay, sorry. So as I said, when you're designing different types of what should be considered in designing, as I said, we have done that. So the general word, you should also it gave you the type of the word, but consider the healthy of the environment, and also have the pediatric side. This also what consider the safety of the ward. Pediatrics, they are vulnerable, and psychiatric people, they're also vulnerable. So safety is very important here. Geriatric ward, there's also safety and comfort here. Obs and gynae ward, they also need what? Because they always see they've been exposed. So privacy is very important there. Yeah. ICU, nursing care, then OT, infection control. So these are some of the factors that you should consider when you are designing different types of ward. Well, different types of ward. So then the sanitary hygiene regimen of the ward. And the sanitary hygiene requirements in the wards are what? Need optimal temperature in the wards should be what? At least, so take note, it's 18 to 20 degrees Celsius. So I have to correct the degrees Celsius. Wiping the floor, windows, furniture, at least twice a day, 2 times a day, in the morning and the evening. And in some departments, more often, for example, in the infectious department, 4 times a day, you need to make sure that and morning wiping should be finished till 9 a.m. when all the staff are in. Then you also need your white coat. So hygiene requirement for the medical staff, your white coat, your tidy appearances, short nails, special hospital footwear, which can be easily disinfected. Example, leather, hands well washed up with soap. Then to medical assistants, engage in surgical equipment, manipulations, watches, rings, varnish on nails are all forbidden. But this day, you don't even look at that. So if you're an award in charge, please make sure you follow these requirements. So according to indications, the maternity, infectious department, epidemic, or influenza department, a mask must be put on. It is necessary to change a gauze mask every 4 hours as an opportunity. So physical facilities of the ward. So the area, let's see. Area requirements per bed is what? 70, 90 square feet. Area separated from noise and disturbances. Approachable from support services like CSSD, blood bank, imaging and lab. You should need them. moving spaces, we are talking about this. Ward can be T-shaped. So according to the type, it can be T-shaped, L-shaped, rectangular, or rectangular shaped. So these are the types of ward design that we need. Open ward or Nightingale ward, that is ward that we have. Modified Nightingale ward. We also have bricks pattern ward. That is, you can have the unilateral or one, or the two, the bilateral, T-shaped ward, L-shaped ward, and cruciform type of ward. So these are the Nightingale wards. So this word was designed in 1770 by what? Frenchman, but it was later adopted by Florence Nightingale and is known by a name. So that is why we have the Nightingale ward. And these are the characteristics of Nightingale ward. And this ward should be open plan ward. It can contain about 25 to 30 beds. Then the patient bed are located in 2 rows in a long rectangular ward. So as I said, it can be rectangular or T-shape or cruciform. It may have what? Side rooms for utilities and perhaps 1 or 2 side rooms that can be used for patient occupancy when patient isolation or patient privacy is very important. And the nursing station, doctor's room and other facilities at one end, then bathroom and WC at the other end. So this is the ward that we have. Example of Nightingale ward, as you can see, as I say, the characteristics is rectangular in shape. Rectangular, that is where we have what? We have, as I said, patient bed are located in 2 rows in a long rectangular shape. The Nightingale ward. So as you can see, the patient beds are located in 2 rows in a rectangular what? Shape. And we also have the nursing station out in there. You can see the nursing station. Then we have the service room and the WC and the so that is the Nightingale ward. So you see the modified one where we have the nurses station in there. So we have the rectangular shape. These are the advantages. It's good visibility. You can see all the patient there. There's economical benefits. It's easy to construct. Good possibilities for ventilation. Then these are the advantages. This is the noisiest type of ward. No privacy for the patients, even though you can see them, everybody, but there's no privacy. And you know our kind of system, you need privacy. High risk of cross infection, as you have the 1 year, no privacy. So then we also have the Rick's ward. So it was first made in Rick's Hospital in 1910 in Copenhagen. And these are the main features. Ward unit is divided into small compartments separated from each other. Modern trend is to have cubicles. That is, we have 1 or 2, 1 to 5 cubicles, beds in each cubicle. Then each compartment having 4 to 6 or more beds arranged parallel towards the longitudinal wall. Bed may be on one side or both sides of nursing station. So this is the Rick's ward, as you can see. This Rick's ward. So the Rick's ward, now you can see the cubicles in there. Even though it's rectangular, but there's a cubicle, as I said, there's a cubicle here. So as I said, modern trend is to have what? Cubicles of me. Sometimes we have 1, we have 2 people, or we have 3 or 4 to 5 inpatients. So beds in each cubicle, sometimes it's 1. So depending on the size of the cubicle, you can see every cubicle has a curtain in there. They also have the nursing station there and the beds as well. So these are the advantages of the Rick's ward. So these are the advantages of Rick's ward. Patient beds not visible to outside visitors, except for visiting hours, because it is structured and we have cubicles. So there's a cubicle where we have our patient, and so it's divided by the curtains, give a more clean and tidy look. It provides a barrier against psychological shock for other patients during emergency situations. So no patient can see what is going on with other patients. So it kind of relief for the patient so that they cannot see all the emergencies and the traumas going on in the ward and the death as well. It's more there's privacy in there. And these are the disadvantages for risk hospital. Communication between nurses and patient becomes more difficult unless you go towards the cubicle. Then patients deprived of direct observation from nurses unless the nurses go to the cubicle. Walls become longer, consequently, nurses have to run more. So you go here, you go here, you go here. Unlike the Nightingale where you can sit in the middle, you can see every patient. But this one, they have their own cubicles, then you cannot see them. So it becomes the running errands, going up and there becomes frequent. Everything you need to stop every now and then. You need to get up and go to their cubicles and see how they are faring. So these are the patterns. More nurses are required because we can't have one nurse running in the ward for a particular shift, because we have the cubicle, so we need more nurses to go through the cubicle and see how the people are caring and also deliver your care. So this is the risk pattern, costly to build and more and maintain. It's costly. So these are we also have the T wards. These are the modern wards. The T ward, as you can also see, is built in a T form. So these are some of the samples of ward that we have. And the nurse bed ratio. So when you go to the Department of General Medicine and Surgical wards, ideally, in-charge nurse have 1 to 25 beds, and the staff nurse have 1 for 3 beds. So as a staff nurse, 1 staff nurse can take 3 beds, but the whole ward can take about 25 beds. So when you go to ICU, we have in charge 1 for each shift, then 1 for each bed shift. So these are some of the bed ratios for the operation theater, the obs and gynae, pediatrics, casualty and emergency, and we can also do a reserve in all category of patients. So that is the bed ratio for the departments. So the in charge and the and the staff nurse. These are the components of ward management. So the ward unit, we have the ancillary accommodation, auxiliary accommodation, sanitary accommodation, and primary accommodation. So the primary accommodation consists of single bedroom or multiple bedroom for patient. That is primary accommodation. With the ancillary accommodation, the service for direct support of treatment. That is we have that kind of portable X-ray. We have the pantry, dietitian service in and mobile pharmacy. So that is where we have everything in there. Then the auxiliary accommodation is service for indirect support of treatments. And this is usually common for 2 to 3 floors. And this includes the stores, the housekeeping, ward lab, seminar teaching rooms, and these are the nurses, doctors' restroom and visiting room. So that is the auxiliary accommodation, service for indirect support of treatment. So these are the supports that we can have for the patient. So that is where we have the stores. We keep our things in there. So when you go to the stores, medication and everything, we have some in the stores. Then the housekeeping, we can also have then the ward, the lab, the seminar teaching rooms. These are all rooms that can also help in facilitating our ward management, managing the ward. Because as I said from the beginning, ward, we have students, nurses, medicals, nurses and all those people and the research. So we need to get all these rooms. So when some of the students come, we can teach them, go to the seminar room and do the seminar. Even in the hospital, we do we do teaching, we do seminars, we do a whole lot of things. So these are the things that we can also have to also help beef efforts, to also help in what? Managing the ward. And the sanitary accommodation consists of what? Consists of WC, bathroom, and service room. Okay. And with the primary accommodation, you can have what? Patient housing area, size of, I've done this. So these are the summary of all the things that I have said about patient housing area, size of room, you can consider size of room, ancillary. These are the words that are also what provide indirect support treatment. Okay, then the sanitary. So this is the kind of what summary of what I have said. So that is organization. When you go to the ward, you have done organizational structure. So this organizational structure of the ward, the organogram. So we've done organization. In the first semester, we did organize the organizational structure. So with the organization of the nursing service, you have chief nursing officer, nursing superintendent, deputy nursing superintendent. So deputy nursing superintendent and ward sister, clinical supervisor, staff, nurse, students, nurse. And you know, it depends on the hospital, but basically these are the structure that we have. As I said, it depends on the type of organization. Sometimes some organization can be small, can be big. So it depends. But basically, these are the what structure that we have. With the chief nurse, he is the executive head of what? All the nursing services. Then assistant chief nurse would assist the chief nurse in planning, setting up what? Supervision of staff and education program to nursing services. Then supervisor, that's the one in charge responsible for management of nursing care, nursing service in all inpatient units. Then there's the functions of the supervisor: planning, organizing, communication, problem solving, and decision making, and motivating, and what? Maintaining discipline in the hospital. And the senior nurse responsible for administration of particular units, maintains the standard of patient care, supervises the nursing activities in their units. And you know what staff nurses do? They are responsible for rendering what? Nursing care of patients. They assess, they plan and implement nursing activities. They act as a team leader, must be able to carry out doctors' order within hospital policy and legal limitations, maintain records and nursing notes and individual care. So, you know, the functions of the ward nurse, you know, it's many, as you can see. You have so you see he's having what? The bedpan is there, the tea, whatever. So communication and all those things. So you see, nursing in charge, and all the nurse in charge have so many duties that it's supposed to perform. So the ward sister is all responsible to the nursing superintendent, yes. Or they sometimes when you go to the another some hospital, they call it what? Matron. So matron for the management of the wards and supervision of the nursing and domestic staff. So these are the functions of ward sister. So we have the categories. So categorize ward rooms, assign patients to the wards or the rooms, check beds availability, maintain ward unit status, track patient ward information, and maintain patient discharge information. So basically, these are the functions of what ward sister. And these are their responsibilities, keeping in mind the sufficient supply of materials. So when you go in the morning, you check for what? If you have enough supplies to take care of the ward so that you don't move. So I can remember when I was a ward in charge, another ward will come. Oh, we need this, always borrowing. Because I think the ward in charge was not that kind of effective and efficient. When he's going to not check if everything is intact. So when he's not around, he's not around, you see that the staff will come to another ward. We need this thing is false. So as a ward in charge, you keep in mind the sufficient supply of materials. So when you come, you just update whatever you have, then you make requisition. Material should be in good condition. So check if every material, the oxygen cylinders, BP apparatus, everything that was in the ward is working well. Giving responsibility to handle supply and equipment. So you need to replenish everything, checking for misuse and how to minimize it, educating the ward staff and other healthcare workers in the economical use of material. So these are the attributes of ward manager. The attribute of manager has vision, mission, and wisdom. So should have ability to see and think about the future with imagination of an important task assignment ahead. So with wisdom, he or she is focused, not sitting to wait for events to occur before thinking of how to handle challenges. He is also hardworking. So elevation of a nurse practitioner to a ward manager often emanates from hard working in charge, because success comes from hard work. So a hard worker does not believe in shortcuts. Try to maintain the highest standard to achieve excellence in nursing care of their patients. Is disciplined, has good listening with good communication skills. So a good ward manager should have good listening communication skills. She should always give a listening ear to the subordinate and patient under his care. Elevates communication, enhances so as I said, effective communication enhances understanding and cooperation. And there's other attributes are humility, tactful, diplomatic, and courageous, and confident. Hello.
Hi, madam.
Okay.
We can hear you.
Okay. So let's continue. The internet is not stable at all. Okay. Thank you. You're not. Okay. So as I was saying, these are the duties. So the head nurse, the duty of a head nurse is to plan, and we have gone through that. Then the head nurse has a whole lot of duties to conduct within it. Okay, so with the medical and billing section, these are the duties. They admit, classifies, pay, and medical patients. They orient patients with regard to privileges, obligations, responsibilities during the course of confinement. Prepare statement of account on service and bills rendered to patients. File records, bills, and statement of account. So these are some of the duties of the Medicare and billing section. So when you go to the hospital, as I said, they are all part of the auxiliary people that help in the management of the hospital. So even though they don't provide direct services, they are also there to help the management, because if they are not also there, things will not go on well. So when you go to the hospital, we have the accounts, the accounts office or the billing station. We also have the dietary services. They maintain or enhances the health of the patient and personnel by providing them with high quality and nutritious food through an efficient dietary services. They also provide services of safe, nutritious, and attractive food through careful planning, wise procurement, and proper preparation of balanced and satisfying meals within budgetary limits. They implement diet prescription in coordination with physicians and nurses, provides nutrition consultation, education service to patients, as well as in-service training to both dietary personnel and other related fields. They promote and maintain the hospital departments in the hospitals. And we also have the security, ensure safety of hospital patients, facilitates and personnel maintain peace and order, and enforce hospital rules and regulations. And the personnel section are what? That is the development and what administration of what comprehensive manpower development program, which includes recruitment and selection. So we go through recruitment and selection, promotion, training, employee welfare, and benefits, manpower planning, stage. Property and supply. That is where we had a procurement, storage, and inventory distribution. So hospital sessions and supplies. We also have housekeeping session. We have learning and laundry, where you go and what. So ensure adequate supply of clean linens for patient and hospital units. Engineering and maintenance system, installations, operation and maintenance of electrical, mechanical, and communication equipment and allied facilities, including buildings and vehicles. We also have motor pool section for convey transport patient and wherever they want to go. So now, all what I have said was what? How do we manage what? What management? Ward management. So what is ward management? The ward is what? The patient's home. We had discussed that, where the patient spends his period of what? Hospitalization. So ward management, according to CODeL, F, and Beck, is a process whereby, it's a process. We talk about ward. What is hospital? What's a hospital ward? But what is ward management? So as I said, it's a process whereby the ward manager, through people and with people, make use of what? Ward resources to achieve what? Ward objective. So that is ward management. And the objective of the ward is to provide highest quality nursing care for patients, to provide a clean, well-ventilated environment for patients and protect them from infection, accidents, and hazards. We also have to protect what? To help the staff in achieving highest degree of job satisfaction. So it's not only about, as I said earlier, not only about the patient, but the staff as well. And these are the components of ward management. So we have management of client and care, management of the personnel, management of supplies and equipment, management of the environment. So these are the components of ward management. So as I said, management of client care. One component is what? Management of client care. And the second one, so we have 4 components: management of the personnel, management of supplies, and management of the environment. So how do we manage client care? See there. So management of client care. So we admission and what? Orientation of the clients. So these are the nursing station. Assessment of client needs and care, progressive client care, priority nursing care, assignment of personnel for client care. So when you go to the home, you see that the nurse in charge will assign staff. And give them task, planning the time schedule and work status. Then you go to ward rounds, records and reports, management of emergencies, client teaching. So as I said, these are the activities of patient care. So with their clients, it includes all activities necessary to provide nursing care. We talk about it. So these are talking about all the things. So number 1 is what? As I said, the client, admission and orientation of the clients. So with admission and orientation of the clients, that is the hospital routines of hospital, rules and regulations, personnel working, ward equipment, and ward procedures. So as I said, with the management of client care, number 1 care is what? Admission and orientation of the clients, as we see on the screen. Number 2 is what? Assessment of clients' needs and care. And this assessment of client needs and care, you need to establish patient airway. These are the client's needs to check for adequate circulation. These are our assessments. So support of activities of what daily living, psychological support and spiritual needs, and continuous monitoring of clients. And number 3, care is what progressive client care, organizing client care units according to client needs for medical and nursing care, such as intensive care unit, intermediate care, and self-care unit. Number 4, priority nursing care. So with what? We need what? Self-actualization, morality, creativity, spontaneity, problem solving, lack of whatever. So the self-actualization, they're supposed to be what? Acceptance of facts. So we prioritize nursing care according to the need of the care or the emergency of the hospital, emergency situation. So you can use this as self-actualization, esteem, love, belongingness. Safety and all those things. Then number 4 priority is what? Assignment of. Number 5, the task, assignment of personnel care. So with assignment of personnel for client care, we have what? Functional method, client's method of assignment, nursing team method of assignment, and nursing client's ratio. You look at all this before you do the assignment. Then number 6 is what? Planning the time schedule and work schedules. This one, you provide adequate nursing care each day to provide best possible experiences for each personnel to promote good relationship and satisfaction. They also need to go to ward rounds. So ward rounds, then we go to ward rounds, records and reports. So we record and report 24 hours reports, census reports, anecdotal reports. These are all some of the reports that we have. Then management of emergencies, client teaching, appraisal of nursing. So we do that. So what is patient care? So when I was talking about patient care, I talk about what? Ward rounds. What is ward rounds? What is it? Ward round. It's a tool. It's very important. Ward round is a tool of supervision, evaluation, and teaching centered on patients in the ward. Ward rounds plays crucial role in reviewing and planning a patient's care. It is an important opportunity to inform and involve patients and for joint learning for health. So most important records, so as I said, ward round is the most important records in the hospital. Doctors and nurses are 2 essential figures at ward round. It is no way necessary for ward manager to feel inferior to a doctor when he or he comes to the ward. No, we are all doing a job. So we take ward rounds if you allow doctors only to go. So what will be your portion? How will you know what has been prescribed, what is going on with the patient? So we all join hands together, then we do the ward rounds. And the sister, her function is that of coordinating the teams which functions for the benefit of the patient. And these are the types of ward rounds. Ward round is of the you have the doctor round, nursing superintendent's round, and in charges or nursing supervisor round. So doctors round, and these are the activities to be performed before the rounds. You need to keep ready all the investigations that were requested, to complete patient chart organized in order and ready, to keep units ready, all equipment in order, and all the patients are in bed. So make sure that all the patients are in bed, except that maybe they have gone for physio, wherever, because it has been scheduled. So these are the areas that you need when conducting ward round. As you can see, instruct the staff nurse to stay on patient left side, please. So see, instruct the staff nurse to stay on patient left side to help in patient examination, please. So take notes. Remember and report observations to the doctor. Record orders or get them written by doctors. So after the ward round, instruct staff nurses to carry out the orders observed. So that is why we have our own ward rounds book. Whatever we have been given, we write them the ward rounds. Then after that, we do it. And so that is the doctor's one. The nursing's one, there are several methods that can be used effectively in clinical teaching. So nursing rounds are conducted by the head nurse or nurse teacher with the members of her staff or students for a clear understanding of the disease and the effect of nursing care for each patient. So ideally, when we have done our own ward rounds, we can also have a coordinator for students who also can also have his or her ward rounds by a nurse. So the nurse is one which presents an overview of certain aspects of nursing care or medical care of all patients on the ward or selected patient. And these are the purpose: to observe the physical and mental condition of the patient and the progress made from day to day, to acquaint nurses with all patients of the more purposeful care that may be achieved for each patient, to help nurses get acquainted with new patients. Nurses round provides input and feedback from the perspective of patient care, and therefore gives an opportunity to clarify issues related to patient care, and also facilitates a detailed discussion on the nursing care of a single patient, to observe work of staff. These are the ways of conducting ward rounds. So when rounds are conducted, the teacher goes to the patient's room with a group of nurses. So, but we nurses, we don't do it. We only leave it with the doctors. You know, the doctors ward round with their patients. We had the general ward rounds that they come to the ward with the nurses. But also have a nurses ward rounds. We also have the medical or doctors ward round where they go to the ward with teaching their patient, their students. But we are supposed to do that, but we don't do. So outside of the door, out of his hearing, they describe the objective, after which they go to see the patient and talk for a few moments with the patient. They then move on to the next patient. So these are the ways of conducting what's necessary. Matrons, matrons rounds. So apart from nurses round, we also have the matrons round that I told you. So nursing supervisors round. So what sisters should also take round with what? Staff nurses, but I don't, but where I was, I think every morning, the sister will come, the matron will come to the ward, but it's like she will not organize the nurses to follow her. She comes to the ward, then enter the ward, the cubicles and all those things, then she comes to the nursing station and asks of what, you read the reports and ask about the condition of the ward. But ideally, you're supposed to follow the sister when he's going for the ward run. So she observes patient who is physically ill and requires close attention to attend or supervisor normal routine of work, to check poison cupboard, to have an idea of presence, task of medicine, and also to note the standard of work. So matron is usually looked upon a confident advisor. She must visit ward regularly and take this opportunity to provide guidance to the nurses. Okay, so as I said, we have general ward rounds. We also have with the doctors and the nurses doing the ward rounds. We can also have doctors doing ward rounds with their students. We can also have nurses doing ward rounds with also their students and the nurses. Then we also have the sister also doing ward rounds with the nurses. Okay, that is the ward rounds. And then these are the principles for best practice during ward rounds. You need to structure the wards. That is where you need to prepare, schedule, and post-ward round review with allocation of tasks. There is also patient participation. So as I said, prepare the patient, make sure the patient are in their beds. So preparing patient in advance and promoting shared decision making. Then also need to protection of vulnerable patients. So one manager should ensure their needs are articulated and addressed. You also need to ensure nurses' involvement. So when we go to ward rounds, we also need to be involved. and we have been doing it. So don't, at least you can let one nurse stay at the nurses station, but the rest of the nurses can follow what's the doctor during ward rounds. Use of safety checklists. This will reduce omissions and variations in practice. Then the start planning. The start planning, how give detailed plan on how towards patients should be discharged. So that is the first one was what management, the components, we have 4 components. Management of what ward branch. So management of patient care. So after you have done the management, so all that I have talked about is what management of client care. The number 2 component is what management of the personnel. It's not only about the clients. So when I talk about what the components, I said about what the number 1 component is what management of the client care, and that is what we have done. Then number 2 is management of the personnel. How do you manage personnel? So when you want to manage personnel, we orientation of the new personnel. And oftentimes we employ or appoint people's nurses, not level nurses, doctors, or staff. So when they are employed, we need to orientate what's the new personnel, supervision of the personnel and delegation of authority, establishment of IPL, evaluation of what the personnel, staff conferences, staff development program, health, safety, and welfare of the person. The number 3 component is management of supplies and equipment. So one component is, the first one is client care, and that one is lengthy. The second one is what? How do you manage personnel? And the third one is, how do you also manage what? Supplies and equipment. So as a nurse in charge, when in the morning you go to the ward, you see to it that all the supplies that we need, all the things that we need to manage people, they are intact. So when they are not intact, you make a decision in the morning, and you also make what to replenish whatever things that were not there. So that is a good manager. You are not in short of anything. Supplies and equipment are always available, and this used to be what? Judicious what? Use. So if effective and efficient use of these resources, it's also what? The primary responsibility of the ward manager. Okay, so establishment of, okay, so these are the supplies that we're supposed to what? Engage with, was also keeping an adequate supply at hand, standard for quantity of each item, system for replacing broken equipment, regular inventories, and intelligent ordering. So you also need to have what? Inadequate supply of materials. So you also see to it that every time you go to the wards, there's what the supplies and materials are what's adequate. When they are not there, you make requisition and replenish them. Equipment may be out of order. So what do you need to do? You need to make sure that they are there. Supplies and equipment may be inaccessible, make it accessible. Equipment is inconveniently located, make it located. So then after the supplies, the 4th thing is what's management of environment. It is very important and crucial at this stage. How do you manage the environment? So with the environment, sanitation and what? Provision of therapeutic care. So when you want to manage the environment, you need to make sure that there's what? Safe disposal of what? Excreta, safe water supply, dust control, elimination of what? Unpleasant odors, proper light and temperature regulation. So these are the things that you need to manage in the environment so that things will go on well. So these are the management of what? Environments. So adequate lighting, I've talked about it. Prevention of noise, elimination of unpleasant odors, I've talked about it. That is where the sanitary department will come in. Dust control, safe water supply, safe disposal of waste, freedom from what? Insects, provision of adequate privacy, prevention of cross-infection, and control of visitors. So these are the actions for ward management. So you can delegate responsibility for patients. So when these are some of the actions, as I said, you can analyze nursing needs of patients and skills of patients, prepare monthly, weekly, and give teaching and guidance to juniors, assign tasks to nurses, maintain inventories, requisition for supplies and services, evaluate personnel, coordinate with other departments for what? Effective patient care, gain cooperation from subordinates and supervisors, delegate responsibly. So these are the factors affecting ward management. These are the factors affecting ward management: knowledge of the ward, planning the schedule of the ward, starting the work on time, preventing interruptions, establishment of ward routines, use of democratic methods in establishing ward policy, orientation of what, these are all the factors of ward management and these are the golden rules of good ward management. You need to arrive early on duty. When you go to duty, also make notes. You also have to make what? Time planning. As I told you last time, estimate how long it will take to accomplish a task. Add time estimate next to each task personnel so that you can see at a glance how much time you are likely to spend on each task or each patient. You need to prioritize your task, follow schedules, be flexible. So working on a ward can be unpredictable and your expectation can change very quickly. So learn to be flexible and respond to what's going on around you. It may be useful to regularly reassess and refresh your to-do list. We told you last 2 weeks when I did time. You need to encourage yourself, appreciate yourself for the achievements made so far. With practice, you'll get better at time management. So as I told you, at time management. So encourage yourself. It is all in the time management that we say. First thing first, learn to say no with compassion. Example is what? Sometimes like, I'm sorry, I have to deal with this right now, but I will be back to help you in a few minutes. This is because other colleagues or patient practice may be what? Different to yours. So try not to assume they would understand. Take a break. The stress of the world may make you feel like you can't take a break, but using a few minutes to recollect your thoughts and actions, and it helps you to be what? Focus on what you are doing. So take a break. These are the golden rules. And these are the criteria for good ward management. If there is a team spirit, then everybody will come on board as that kind of what? A spirit the cause. Positive reinforcement, economic and improved working conditions. Follow unity of words in action, strict observation of rules and regulations, orientation for new staff, in-service education, guidance, and counseling. So in summary, you need to be knowledgeable about the ward. So you are done ward management. You also done wards and hospitals, and the component of ward, hospital, then the component of also what's the ward or management of the ward. And you have 4 components of management of the ward. Also have core components of the hospital. So read and to understand. So you need to have knowledge of the ward. You need to plan the schedule of the ward, start the work on time, prevent interruptions, establishment of what? Ward routines, use of democratic method in established ward routines, orientation of what? New staff, orientation of hospital, maintenance of city environments. We have gone through all this, providing supplies and equipment in hospital, clear cuts, specific orders for medical therapy and nursing, record keeping, maintaining accurate words. So these are some of the things that we have talked about. So it is very important to, as nurses, and you are some of the in charges, know how to manage of the ward. It will help patient what? Safety. So save one life, you are a hero, but save 100 lives, you are what? A nurse. So do you have any questions on this word round? Any question? Hello, word rounds. Any question? Yes.
I have a question.
Yes, ask.
You said first nurses stand at the left side of the patient.
Yes, and I gave you the reason why.
Yes. The patient bed is close to the wall. So that may be.
I can't hear you.
I said in a situation whereby the patient bed is close to the wall.
So that is why we need the money. We need to arrange them well so that you stand on the words. So, but when, so that is all what management of the ward. I ideally when the situation demands. But if there is such a case, then you can stay where you can. The patient can also see you and see the doctor before me. But ideally, that is how it's supposed to be.
Okay, sister. So which means it's not good to.
So ideally, your thing is not clear. Hello.
Hello. Hi.
Let's chat.
Okay.
Hello, madam.
Yes, I'm listening.
Listen, I have a question.
Yes.
Please, is there any specific rule and speaks of that?
Oh, please, your line is breaking. Can you come again?
My question is hello.
Hey.
Hello.
Yes, I'm listening, please.
My question is there any specific rule in arrangement and placement of the hospital?
And that's, yeah, those I told you that when designing, when you
look at the word and the C word, that even the capacity are varied.
The line is faint. Your line is faint. I can't hear a thing. Pepra, come again, but I can't hear you. Your line is breaking.